To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
Breaking news, a national emergency declared by President Trump puts into perspective the potential danger coronavirus poses to our country. I'm Sarah Diamond. The national emergency puts into place guidelines for the United States as it prepares to battle and stop the spread of COVID-19. Cases increased today in both Tennessee and Virginia. 26 reported in Tennessee, 30 into Virginia. Tonight, healthcare organizations, government, schools, and community organizations are all responding. The national emergency declared by the president will free up about $50 billion to help the states and cities respond to this respiratory illness. It also increases testing capabilities and asks every hospital in the United States to activate their emergency preparedness plan. Ballad Health responded to the president's declaration during a news conference late this afternoon. Josh Smith reveals Ballad's plan. Josh?
Good evening, Sarah. Ballad Health here at their corporate headquarters in Johnson City held a 4 o'clock news conference, well, actually right after the president stopped speaking. Alan Levine, the CEO of the health system, confirmed that tonight Ballad Health is not treating any patients for any coronavirus illnesses. They made that very clear, and those numbers backed up by the Department of Health in Tennessee today and the Department of Health in Virginia. The health system is, though, for the possibility, even the likelihood, that that is going to happen. And so tonight, Ballad is putting into place some brand new restrictions on visitors to its facilities, and the healthcare company has given us access to what they call their Emergency Operations Center. If you listen to the president today, he asked hospitals to enact their emergency plans. Ballad enacted theirs on Tuesday, and tonight we were able to see that center right around the corner from where I'm standing right now. It's in full operation tonight. That Emergency Operations Center is being staffed by healthcare leaders. They are currently monitoring communications within the healthcare network and outside as well. Earlier today, President Trump said he was lifting numerous restrictions on hospitals, allowing them more power, more broad power to deploy assets, and giving them the ability even to open up emergency care centers in facilities that don't provide emergency care. At the news conference this afternoon, Ballad CEO Alan Levine announced a couple of visitation policy changes taking effect Monday.
We've decided to restrict access to our hospitals and require screening for those who enter our facilities. And this will affect vendors, volunteers, and any other visitors. We're going to be limiting access for visitors to 1 visitor for each patient and for people that are over the age of 18.
Ballad Health also saying no visitors to their long-term care facilities. Again, that's starting on Monday to protect the people who are getting care there. The hospital already was asking anybody who had sickness-related symptoms to not come because of flu. This is just a reiteration, even an intensification of that. Levine said starting March 16th, students in training and volunteer students cannot come to the hospital for continued education. However, that does not affect resident physicians. They will still allow them in to continue their training. Levine said that the measures are until further notice, and he made it clear that though some might consider this to be an overreaction, he says that is a risk that he and Ballad Health are worth taking.
I'm glad the president did what he did today. The regulations that he's loosened up and directed HHS to give us some flexibility on, I think will be very helpful. And we're going to continue to learn as we go. We're going to continue to be responsive to whatever the needs are.
Levine said the hospital has available bed space, including ICU space. They are trying to secure more ventilators. He said that's difficult because of the global need for more ventilators. He said already this hospital system's taken a $60 million hit from the coronavirus outbreak because of its, the way that the stock market has gone and it's affected cash flow. But he said that money is not the concern right now. The concern is that people do not start coming to the emergency departments or urgent cares if they do feel sick. They want them to call ahead, 1-833-8-BALLAD, that number that was repeated again today. They'll screen you over the phone and then help you determine if you need to move on to that next phase of seeing a physician. That Emergency Operations Center here at headquarters, operational tonight, and Ballad Health is saying that they are prepared, even though tonight there are no patients being treated for COVID-19 here in the health system. Sarah?
Josh, thanks. And Ballad Health established a call center, just like Josh said, for those experiencing those mild symptoms. It's a kind of a first screening. Ballad Health's Nurse Connect number is 1-833-822-5523 or 1-833-8-BALLAD.